about medicine, not politics.
In Northern Ireland, Catholics and Protestants are learning to live with each other. In South Africa, blacks and whites together are building a new nation. But in Israel, Arabs and Jews are as far apart as ever and seem determined to go on killing each other till the end of time. But there is an island of sanity in this sea of madness. It's Jerusalem's Hadassah Medical Center, and it's one of the only places in the region where it doesn't matter if you're an Israeli or a Palestinian. One morning we were there, a young Jewish woman was brought in, a settler who'd been shot in her car by a terrorist. She was 7 months pregnant, and the doctor saved her and her baby. Minutes later, the doctors were called to the intensive care unit to treat not an Israeli, but a Palestinian, an alleged arms dealer who'd been shot by Israeli soldiers. So 10 minutes ago, you were working on a woman who was shot, conceivably by a gun that this guy supplied. Maybe? Dr. Ab Rifkin is a surgeon and head of the Hadassah Trauma Unit.
I am personally inviting you to see what treatment these two patients are receiving. And if you will find any discrimination, let me know.
It's ironic, isn't it, that one of the most, quote, normal places in Israel is a hospital?
Is a hospital. No, it's obvious. It's obvious. Here life means something.
And Hadassah has been in the business of saving lives for 90 years. In 1913, an organization of American Jewish women called Hadassah sent a couple of nurses to Jerusalem to open up some clinics, which grew over the decades into this place, the Hadassah Medical Center, still owned and funded by the same group of American women. It treats nearly 1 million patients a year now, but its guiding principle has changed. Medicine, the motto goes, is a bridge to peace, and every patient gets equal treatment here. The hospital is one of the few places left in Israel where you still see Jews and Arabs together. There may be no greater equalizer than a waiting room. Throughout Hadassah, you'll see Jews helping Arabs, Arabs helping Jews. In fact, you'd never know there was a war going on if you didn't see so many patients with shrapnel wounds and blast injuries. In most wars, doctors and nurses go to the battlefield. Here, the battlefield has come to them. It's right outside. Dr. Shlomo Mor Yosef is the hospital director. This hospital has probably in the last 3 years become more experienced in treating terror victims than any hospital in the world.
Unfortunately, it's true. We treated here at Hadassah about 50% of all the casualties all over Israel.
When there's a suicide attempt like this recent bus bombing in Jerusalem, most of the really serious cases end up here at Hadassah because of its trauma unit. It's the most sophisticated in Israel, perhaps in the world, when it comes to treating terror victims. Victims like Hannah Nathanson, who'd been on the bus with her children. One of them was still missing.
I was with 3 donors. They told me they didn't find one of them. I don't know where she is and her mom. And the pain is indescribable.
She soon found out her daughter was dead. Near Hannah, in the same emergency room, an Arab victim of the same attack was being treated. Yasser Herbawi was driving the bus behind the one which exploded, and like so many people near a blast, his eardrums had been shattered. Do you ever get used to seeing these people come in?
No. No, I'm telling you, you cannot be used to it. I'm all the time emotionally involved.
Dr. Rifkin says his entire staff, Jews and Arabs, is emotionally involved all the time.
If something happened, you don't have to call anybody. Everybody is here. Everybody is coming to this hospital.
Just like that?
Just like that. You are on call, you are not on call, you are on duty, you are not on duty, everybody.
Dr. Rifkin was at the hospital the night a patient named Hassan Salameh was brought in with critical gunshot wounds. Hassan Salameh was a Hamas leader and the mastermind of a series of bus bombings that killed 45 Israelis. Don't tell me that looking at Hassan Salameh on the operating table and knowing who he was and what he had done, that it wasn't different for you than treating another patient.
You know what? In the opposite. I want to prove him that when you came to a Israeli Jewish doctor, you received the best treatment in the world to show them we are human beings.
It's a message he hopes Salameh's Palestinian followers have digested.
They know that Hassan Salameh, the hero, was tried to killed by Israeli soldiers and was saved by Israeli doctor. I don't have any problem with it.
No problem. That's almost become the motto of the people who work at Hadassah. But does it really work that way? Not according to the man in charge who sees what happened to his staff since the war began.
They shout more. They are in not an easy and comfortable way. We see change in their behavior around the hospital.
The physicians say that they're not under stress, but you see it.
No question about it.
And you see amazing scenes as well. This one, for example, the patient, Palestinian journalist Ahmed Jadallah, surrounded by young religious Israelis watching Jadallah's videotape. There he is on the ground, just after he'd been shelled by an Israeli tank in Gaza. He was brought to Hadassah, where he woke up in a room with strange bedfellows. In this hospital, when you got out of the surgery,
Yes.
you were in a room, and the other patients in the room were an Israeli soldier, a Jewish right-wing settler, an American religious Jew who'd broken his leg,
Yes.
and another Palestinian from Bethlehem.
Exactly. Everybody looked at each other. We don't speak with each other, nothing. Then I start to speak, like, hi, how are you? What's happened to you? Like, with the soldier first. Then the mother of the soldier and the father of the soldier was very nice.
And he says the Jewish settler brought him tea.
You are not in Israel. You are not in Palestine inside the hospital.
Most of the patients at Hadassah's 2 hospitals in Jerusalem aren't terror victims. They're simply people who need treatment. Some of the Arab patients come from nearby countries.
We have wealthy Arabs who are looking for the excellent treatment here at Hadassah. They don't want to be known.
The staff is also a mixture of Jews and Arabs. Dr. Bisher Abu Marzuka is a pediatric heart surgeon from the West Bank who came to Hadassah a year ago to work with Dr. Eli Milgalter, a Jew. They teamed up to make heart surgery available to Palestinian children who otherwise couldn't afford it. Anywhere else in the Middle East, their partnership would be virtually unthinkable.
From the first day, we didn't have to say one unnecessary word. We think alike and we act alike, and it's like we've been working together for 20 years.
You understand the rest of the world thinks that Arabs and Israelis are at each other's throats all the time.
Absolutely, but we are talking about medicine, not politics.
We work in a very harmonic way. I think that we have no difficulties.
Dr. Marzuka may have no difficulties working at Hadassah, but he does have difficulties getting to work. He lives on the West Bank in Palestinian territory, and he has to go through an Israeli army checkpoint to get to the hospital. That can take hours. We all know what these roadblocks are like.
Exactly.
They can be terrible.
They can be terrible, yes, sometimes,
And you're not treated,
as it should be.
and here you are on your way to a hospital where you're a senior surgeon.
Exactly.
Together, they've operated on nearly 100 Palestinian kids. Do you ever find yourself thinking, the two of us work together so naturally and spontaneously, what's wrong with everyone?
Every day. We're not politicians, but maybe the peace can start from just this little cooperations on a human basis, and we can go from there.
I think it's an illusion to believe that this will build a bridge to peace.
Dr. Arya Eldad headed Hadassah's burn unit until earlier this year, when he traded medicine for politics and got elected to the Israeli parliament.
I knew that the problem will not be solved by patching these patients, but by preventing the war.
He's a member of a right-wing party that wants to kick out 2 million Palestinians from the occupied territories. Yet he's not only treated Palestinians, he has saved the lives of Palestinian terrorists. You were treating a terrorist who is in a very bad way. Did you give him the same kind of care you would have given an Israeli child who had equivalent wounds?
Everything. No difference whatsoever.
If
if you had encountered him in the street? How would you have treated him, knowing who he was?
I would shoot him to death. I would try to kill him. I'm carrying a gun with me.
So, if we want to really walk into the theater of the absurd, we can imagine you shooting a Palestinian militant in the streets of Jerusalem.
If he is a terrorist.
Okay. And then rushing to the hospital to treat him when he gets there.
Yes, I know the way, so I most probably be at the hospital before him.
The medical staff at Hadassah are asked to leave their politics at the door. But it's not so easy for the patients, especially victims of terror attacks like Arno Harenstein. He's been coming to Hadassah for over a year for physical therapy, ever since he was shot in his driveway by a Palestinian gunman. So you're in the car,
I was in the car.
and he's shooting at you in the
He's
car.
shooting me from 7 meters. He shot me at the first place 3 times.
While Arno lay bleeding in the car, the gunman shot and killed his wife, who had run out of the house when she heard the noise. Arno was taken by helicopter to the Hadassah Medical Center.
3 times my blood pressure was so down that I was dead, clinical death. Thanks to Hadassah, they succeeded to save my life.
He credits Hadassah with saving his life and giving his daughters their father back. He also credits the hospital with changing his attitude.
A year before, I will tell you, I think that kill all the Arabs. They are all animals.
Did you feel that a year ago?
Yeah, of course.
Kill all the Arabs.
Yes.
But that changed as he worked with Arab therapists and got to know Arab patients.
So then I began to talk, with Arabs person, and to realize again, like I knew before, he is a human being like me. Okay, he is not the one that pulled the trigger. Why to be angry with him?
All of which might just mean that the only sane place in the Middle East right now is a hospital.
This is what we try to show to society, that it's possible to live together. I'm not naive. It's not going to be solved soon, but I think it can show the way for the future.
Since we left Hadassah, the hospital has treated more than 30 victims of political violence, Jews and Arabs.